Hello, my name is Nate Klein and I'm your Vice President for Student Success. And today I'm here to talk to you a little bit about what it means to have a close contact and what does self-isolation mean for our Mount Mercy University community. What should you do if you have COVID-19 symptoms or are close contact? So first, let's define a couple things. According to the CDC, COVID-19 symptoms include fever of 100.4 or greater or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. Now, close contact is defined as spending 15 minutes or longer within 6 feet of someone that has tested positive for COVID. And it doesn't matter if you're wearing a mask or not. It's still within 6 feet for 15 minutes or longer. Now, if your contact has tested positive within that 48 hours, then you would be considered a close contact. For instance, if I have a meeting with Jenny on campus on a Wednesday, and then 2 days later on Friday, Jenny tests positive for COVID-19, if we didn't abide by social distancing guidelines and were within 6 feet for 15 minutes or greater, I would be considered a close contact. Therefore, I would need to self-isolate as well. If she would be tested, let's say that next week on a Monday, so 5 or 6 days later, for positive COVID, I would not be considered a close contact. So it really depends on the proximity, which is why we stress the importance of social distancing. Always make sure that you're 6 feet away from someone, and if you do have to be within 6 feet of someone, make sure you're wearing a mask and you don't spend any longer than 15 minutes together. Now, if you do have new symptoms, please contact your local healthcare provider or visit www.testiowa.com for a free test. If you're a student living on campus, we will have tests available for you. So if you're experiencing any of these new symptoms, please contact our Director of Health Services to set up an appointment to get tested. If you test positive or are waiting for test results, please self-isolate. For employees and non-residential students, this means that you should stay at your residence. Employees contact your direct supervisor and HR, and students your professors to let them know about the situation that you will continue remote learning. For residential students, this means you will be asked to self-isolate off campus. If you are able to go home, you're welcome to do that. If you're not able to go home, we will provide you off-campus self-isolation space at no additional cost. Now, self-isolation periods vary per the CDC guidelines and local health officials. For someone that has tested positive for COVID-19, the CDC and local public health officials informed our guidelines to self-isolate until the following 3 things occur without the use of medications. 1, at least 10 days have passed since symptoms first appeared. 2, no fever for at least 24 hours. And 3, improvement in your symptoms. Now, someone that has been within 6 feet with or without a mask for 15 minutes or longer with someone that has tested positive for COVID-19 or a close contact as we defined before, if this is the case for you, you will be required to self-isolate for 14 days, no matter your test result. As you can imagine, and you've seen throughout the summer, lots of things are changing, and the CDC and local public health official guidelines change often as well. We make sure to stay up to date with all of these local public health officials to bring you the most up-to-date guidance. So be sure, if you have any questions whatsoever, reach out to your direct supervisor, HR, myself, or the Director of Health and Student Services here at Mount Mercy University. You can also visit our website listed below to make sure that you have the most up-to-date information. Just remember to stay safe, stay distance, and be true to your Mustang pride. Thanks. Go Mustangs.